Hi everybody, Doug Adams here to talk all things about running with you. And in this week, I really want to talk about an analogy that I use. And I think it's important not just that we have the skills, but we have the ability to communicate what we're trying to convey to a runner. So runners can often be a little stubborn about how they do things, as we all are. And they often don't want to change some of their habits, even if it's not led to what they want for success, or if it's led them to meet somebody like us for injuries or a need to improve their performance. So I talk about something with runners called the infinite injury loop. And I think this really resonates with a lot of the runners because they realize that they are on this loop, and it helps them to understand that they need to get off of this loop. So when we're trying to convince them about how our services can really be helpful to a runner, how we can use gait analysis and exercises and hands-on treatment, those things, we really want to be able to convince them and convey to them and really speak to some of their troubles that they've had. So I want to go over what this infinite injury loop is. So I'm going to bring it full screen here. We're going to take a look at this. And this probably resonates true with a lot of runners. And especially at this time, there's a lot of new people running right now. And we really want to make sure that they're avoiding this infinite injury loop. So if we start here down below, we can see that when they first start beginning to run, they come in with individual risk factors in their own experience, right? They might be new to running, or they might be coming back after a long time. Over a while, they progress their training, and there's this cumulative load that contributes to whether they're participating with injury or without injury. Unfortunately, about 80% of the runners eventually get to this next part in the cycle where the load exceeds their capacity and they become injured. So what they inevitably do, they'll often push through it for a while, but eventually they're going to modify the load and focus on getting the pain down. This might be a rest or a reduction in load, cross-training. Then eventually they might independently or through guidance of a physical therapist, athletic trainer, chiropractor, massage therapist, they're going to start to work on some of the things like range of motion and pain and strength that led them to get back injured in the first place. Then they'll gradually build back up. They'll do a graded progression, allowing the tissue to adapt. They'll get healthy again. But they only just repeat the cycle. And it's this infinite injury loop of sometimes having pain, sometimes not. And I think really we need to focus how we as running specialists, certified running gait analysts, can intervene to really stop this cycle. And if you see up at the top of the screen, the reason is that we know that prior injury makes you that much more susceptible to future injuries. A little piece of the literature here, you're 6 times more likely to have a secondary tibial stress injury than you are after you had your first one. So that tells us that we're in this infinite injury loop, and I think this really resonates with a lot of our runners. And what we have to do is focus on getting out of it. I think you'll notice that the right side, as you're looking at the screen, the load modification, the impairment resolution, and the graded progression, those are things that we often forget about as we become healthy, and things that we can look at, and things that certified running gait analysts and running specialists can really look to change. So when we talk about this, there's really 4 habits that we want to focus on. There's other things, but these are 4 big habits to break that loop. And as this running specialist, we can really help provide these services and make sure that the runner knows exactly what they should be doing. So one of the first things we say is that they should become an athlete who runs. A lot of times a runner gets very solo focused on just running, and if it's not going to help with running, then they're not going to do it. But we really need to focus on individual mobility and strength deficits in all planes of motion. This is where we use something like the runner readiness assessment to look at the whole body and be able to pick out the impairments in mobility and strength and motor control that we really need to address. But we need to focus on different planes of movements and being able to do different things. So we should have our athletes become athletes who run, not just runners there. Then really the next part is largely education, but making the loads appropriate. So we should have the correct ratios of intensity and an appropriate progression of volume over time. I think this is where we've seen that in the literature, 60% of running injuries are related to training load error, meaning they're doing too much, too soon, too fast. And if we can make those loads appropriate, we'll see that that loop gets broken. The next thing is that we focus on is really practicing their technique. And through gait analysis, we should help the runners know and improve their form so that each step they're lowering the stress on their body, which is going to help them from both a performance and an injury standpoint. So we really want people practicing their running. It is a skill. It's a very highly involved skill that happens very quickly with a lot of force. So just like any sport, if you're practicing your free throws, you should be practicing your running form. Now, the next thing is maximizing recovery. And this is something that we really should educate our runners on again, that improvements only happen when we recover. So if we're doing too much load, we're really not getting the full benefit of their exercises. So we need to utilize things like cross-training, rest recovery, promoting health and performance, and we really need to help them find their unique formula that helps them really recover and get out of that loop. So these are just 4 things that we really think have the most bang for your buck. There's other things that you can do, but when we're talking to our runners and trying to get them to buy into why should I do a gait analysis? Why should I do strength training in the off season? What do I need to do mobility work for? Why should I warm up? Those questions, we can really use this analogy of this infinite injury loop where runners they start running, they increase, and then they have to take time off. And we know that the most gains come from consistency with running. So if you're working with runners, you are a certified running gait analyst, or you'd like to become one, these are just techniques that we talk about. And in our courses, we talk a lot about how we do that, how we identify the 5 categories of running gait impairments, and really show people how to practice their form, what drills they can do. And this is how we use our mobile application to make it in a usable format. So we really hope that this is helpful, and love to hear your own analogies that you use to convince runners that they need to get off of this cycle and really start doing things differently so that they can have a lot more success and enjoyment out of running. As always, if you want to learn more, check out our courses, our free Essential Elements of Running course, as well as looking at our Certified Running Gait Analyst courses and supplemental courses as well. We hope you all have happy and healthy running, and thanks for joining us.